Today, I want to spend some time talking to you about digestive health. When it comes to functional medicine, advertising, and SEO, there's a lot of conversation out there about digestive health, um, gut health testing, 5R programs. Everybody and their mother is on an antibiotic and then a probiotic, and reflux medication. And it has me concerned as a person who has worked in conventional medicine in gastrointestinal health as a GI provider and now doing functional medicine. I think it's really important for people to understand when to do which type of testing and what type of symptoms are important alarm bells to go off. Okay, understanding digestive health. So, some of the most common symptoms that I see people coming into the clinic with include things like bloating, belching, diarrhea, constipation, abdominal pain, chronic sinus issues, asthma exacerbations, chronic sore throat, and food sticking on the way down. So, when people come in, I always want to know whether or not they have had some type of conventional testing. If they have had symptoms on and off for years and never had testing, then I do refer to GI. So, some issues that have me concerned are things like chronic reflux or heartburn for more than 6 months, whether or not you've been on proton pump inhibitors or medications such as Pepcid, Protonix, um, Prilosec, any of those medicines. If you have black, tarry, or bloody stools, it is important to go in for testing. If you have a sudden change in bowel habits, chronic abdominal pain, food sticking on the way down, a lot of times I see people who actually have adapted to food sticking and they just take a sip of water after every bite. And they don't even pay attention to that anymore because the water helps the food to go down. But that's actually a concerning symptom. If people cough or choke after swallowing food, if you have unidentified chronic anemia, or what I mean is no root cause of your chronic anemia. I've actually seen teenagers that have chronic anemia and their symptoms were just not really ever explored. And they had inflammatory bowel disease. So, chronic anemia is definitely something that needs to be figured out. And digestive issues can certainly play a big part in that. Also, if you have unexplained weight loss, and I do think it's very important with this being Digestive Health Month that we reiterate the fact that colon cancer screening really does save lives. And the guidelines changed so that now they actually recommend getting a colonoscopy starting at the age of 45 for somebody with normal risks, so no increased risk factors. Increased risk factors can include things like chronic constipation, family history of certain types of cancer, including colon cancer or hormone-related cancers. So make sure to understand your own personal risk factors in order to determine if you need to get screened a little younger. When we do functional testing, those are a lot of the tests that I do. And I will do functional testing if someone has had a GI workup and their symptoms are just not improving despite conventional treatment. Symptoms can be relatively new in the last several months, then we can just jump right into functional testing. If people wake up feeling fine and bloating gets worse as the day goes on, that's a very common sign of small intestinal bacterial overgrowth or irritable bowel syndrome. Sometimes we'll just start with functional testing and lifestyle changes, and if that doesn't improve symptoms, then we may escalate the workup to a conventional provider. If you have known food allergies or sensitivities, it's helpful to do functional testing. Also, chronic constipation. If you've been diagnosed with irritable bowel syndrome and treatment is not working. If you have autoimmune disease, things like Hashimoto's, rheumatoid arthritis, Sjogren's disease. If you have mood disorders, symptoms of hormone imbalance, joint pain, weight gain and weight loss resistance. And even if you have known inflammatory bowel disease and you have been following conventional treatment and you are interested in mirroring or partnering that with functional health, then doing functional testing can be very beneficial to help augment conventional treatments. Today, I want to review the Genova's GI effects test with you. This is a test that I often do and find to be very beneficial. So now we are going to pop into a test and take a look at what that looks like. Okay, so here is a sample report, and hopefully you can see that well. Okay, so this is just a sample report. Now, I think it's really important to understand that all these little colors around here get triggered by a specific algorithm. So sometimes when you do a GI effects profile, these numbers or these circles may appear green or gray and not very alarming, but that doesn't actually mean that things are perfectly balanced. So the algorithm has specific things that it looks for in order to change these colors. So we really have to actually understand the test. So here you can see this is a very nice little snapshot, and it shows things like digestion, inflammation, dysbiosis, which is a alteration in your microbial balance, your metabolic imbalance, and infection. And then in this sort of colored area or shaded area, what we see here are your personal results. Then on this bottom in the white area, this is just the standard treatments that are recommended. It's the same text for everybody. So actually having a provider go through this with you is important because you may not need every single one of these interventions. So next we come to this page. Genova has done probably hundreds of thousands of these tests. And so over time, they've been able to compare you to what a healthy cohort would look like. And so here, this will let you know, this is where most people's commensal abundance or the total amount of bacteria that you have in your gut. This is where most people settle. And then they'll give your specific results and show you where along this line your results are. Part of what makes a healthy gut microbial balance is we need plenty of abundance. So a lot of a total number of bacteria. And then we want a lot of different types of bacteria. So we want commensal abundance and commensal diversity. Here we see this dysbiosis pattern. So this is where Genova has been able to, again, take all of their information that they have done through many, many tests, and they have been able to identify, is the inflammation that you are experiencing associated directly with your microbial pattern? If not, it doesn't mean that you don't have inflammation. It just means it's not related to your microbial pattern. So again, it'll show you your inflammation-associated dysbiosis score and then your methane dysbiosis score. They specifically are able to pull out methane-producing bacteria and then let you know where do you fall in the amount of methane-producing bacteria that you personally have. Then here we have this breakdown of your commensal abundance and looking at the different phylum of bacteria. So these are kind of the big categories of bacteria. Then in each phylum, we have different species. So we know that we want to have the two most abundant types of bacteria include the Bacteroidetes and the Firmicutes. And then we want to have a specific Firmicutes to Bacteroidetes ratio. And this helps to let us know overall, what does your environment look like? Who's living in there? We have these additional bacteria that may or may not be present in specific numbers. So now on this next page, we see the digestion and absorption markers. This is really helpful. This does not have to do necessarily with your bacteria. So these are non-bacterial results. Your pancreatic elastase, this is how much pancreatic enzymes is your body actually producing. Pancreatic enzyme production is very important. This is an important part of getting your food that you eat to start breaking down up in the small intestine. And when we have pancreatic elastase or pancreatic enzymes that are low, that puts a lot more work on your bacteria to start breaking down food. And that's one of the triggering events that can cause small intestinal bacterial overgrowth or bacterial dysbiosis, which just means an altered balance. So we really want your pancreatic elastase to be greater than 400. So here this person's is low. Then we can see, are you actually, regardless of what your pancreatic enzymes look like, are you spilling certain types of undigested food into the stool? So we measure your protein breakdown and your fecal fat. Next, we take a look at your inflammatory markers. So fecal calprotectin is actually a non-invasive marker for tracking response to therapy for inflammatory bowel disease. But we also just want to know in general, what is your inflammation look like? This is a very particular inflammatory marker that provides a lot of information. Next, we have your eosinophil protein X. This can go high if you have certain infections in your gut, if you have a certain type of dysbiotic pattern. So this is another inflammatory response made by your body. Then we have this fecal secretory IgA. This is that immunology. This is letting us know, what does your immune system think is happening in your gut? So immunoglobulin A is the only immunoglobulin that is specifically made in the gut. It's not made anyplace else in the body. So when we see fecal secretory IgA being either really low or really high, it lets us get an idea of what's happening to your immune response in your gut. Some of the things that can cause IgA to go high include food intolerances, food allergies, and certain types of infections. When we have IgA being low, it could mean that your body does not manufacture a lot of IgA, but it also lets us know that your immune system might be really suffering and not handling the work that is being presented to in the gut. Then we take a look at microbial metabolites. So everybody's heard of probiotics. Then we have prebiotics, which is what we feed the probiotics. And then we have postbiotics. Postbiotics are what your bacteria are actually supposed to create in your body. So fermenting bacteria will produce things called short-chain fatty acids. And the short-chain fatty acids are part of how your microbiome helps to regulate the immune response. So we want to know, number one, what is your total short-chain fatty acid composition? And then what is the breakdown of that? So we have 3 different types of short-chain fatty acids that have been identified: butyrate, acetate, and propionate. Of these 3, butyrate is highly correlated with things like schizophrenia, altered mood, anxiety, autism spectrum disorders, and immune dysregulation. So we are very interested in looking at your concentration of your butyrate in and of itself, but then also looking at all of your short chain fatty acids. Then we get into sort of the meat of the breakdown of your bacteria. So here you can see each of the different phylum, and then Genova has picked out a few key strains. By no means are these all of the bacteria that live in your gut, but these are key strains that have been identified to be tied to your health and your overall health outcome based on their abundance in your gut. So what's interesting and important to note when you are interpreting the abundance of each of these strains of bacteria is looking at this quintile distribution. So if you notice here, there's this little gray mark on some of these bars. The gray mark on this bar represents the percentage of normal gut flora in individuals, the percentage of people who just don't have any of these bacteria. So you can see here, not a lot of people have this particular strain. of Bacteroidetes, okay? Having it doesn't necessarily mean that you're abnormal. It just puts you in the part of the people that do have this. And then within that, we can take a look at, is it overgrown or in a healthy state? So really important to understand what these gray bars mean. So taking a look at this, we can see that this sample report has some overgrowth of certain strains, such as the Prevotella. I'm not going to try and pronounce every single one of these, but you can see that it lets you know what exactly your number is. Another interesting thing that the GI effects pulls out is how they share your bacterial culture. So this is part of the culture, and that means that they have grown out bacteria and also yeast spores. And then they will rate your bacterial culture, these findings, again, based on the normal amount that you would see across healthy populations. And when we have these 2+, 4+, it lets us know how much overgrown are these different types of bacteria. Then it lets us know, are these non-pathogenic bacteria, potential pathogens, or actual pathogens? So here we can see on this sample report, there is quite a bit of growth of E. coli, this alpha hemolytic strep, Klebsiella pneumoniae, and Klebsiella pneumoniae is considered a potential pathogen at this level. And then this particular sample is showing out overgrowth of Candida. Then we get into the ova and parasite exam. So I love this test because it is so comprehensive, and we can see that they test for all of these different types of parasites. Additionally, there are protozoans that are looked for. And in this particular test, you can see that they did test positive for 2 different strains of protozoans. And then we get this final additional result. So was there any blood in the stool? What is the color of the stool, the consistency? And then there are certain add-ons that we can put on the GI effects report, and that includes things like zonulin, which helps to check for leaky gut. We can add on things like H. pylori, or looking for very specific types of bacterial strains that we might be really concerned about. So that is a breakdown of what the GI effects profile looks like. Once we have all of this information, we're able to tailor a very specific plan for your body to address your personal needs. So does that mean that we need to put you on a kill phase because you have overabundance or overgrowth? Do we have to put you on a rebuild phase because you actually don't have much abundance and that bacterial count came back low? What is your products of digestive breakdown look like? What does your inflammation look like? Do we need to consider doing food allergy testing? When it comes to food sensitivity and food allergy testing, I typically don't start with that right away. I often like to take a look at the GI effects first, or some type of gut health testing, and see if that secretory IgA is really elevated, particularly if somebody is not having symptoms such as a rash or itchiness, or has not been able to identify any type of specific food that they're allergic to. So this is where learning how to build on functional testing is really important, and determining which test should we start with, and then that helps us determine what the next step would be. When it comes to handling the results of some of these tests, it can be a little bit overwhelming if we have things like bacterial overgrowth, protozoan overgrowth, lack of enough digestive enzymes, too much inflammation. So as a provider, I like to stage my treatments for individuals because number one, it can be costly. Number two, it can be overwhelming. Number three, when we're talking about lifestyle changes and also trying to address things like hormone balance, stress response, thyroid health, or address inflammation from autoimmune diseases, it gets to be a lot on your plate to do 17 different things all at once. So oftentimes when people come in to visit with me, I like to really find out what are their most pressing issues and where do they want to start? Because this is a conversation and it is your body that we're trying to heal. So we have to move at a pace where it feels the best for you. Sometimes we will start with a gut health test. Sometimes we'll start with some more foundational lifestyle changes and nutritional support and getting energy back up before we go to a gut health protocol. So, this is where working with your provider to come up with an individualized plan can be very helpful. My hope for all of my patients is to help them have an overall strategy for their health so that they are maintaining their optimal health now, but also looking for the future in order to prevent disease and maintain longevity. I hope that this was helpful information for you. We are offering uh, a discount on the GI map this month. So you can certainly give our office a call to find out what that would look like. And this is November of 2023. So have a great day and enjoy keeping good care of your digestive system.